Dr. Chloe Carmichael, welcome to the program. Tell us, before we get into this conversation about Can I Say That and what people will learn from reading the book.
Thank you. So Can I Say That? Why Free Speech Matters and How to Use It Fearlessly is a book about the mental health benefits of free speech, so that I'm guessing all your listeners probably love free speech already, but at least it gives people a way to answer back if someone tries to say, oh, you have to be quiet because of hate speech and bullying. And it also does have some good techniques for speaking up, as well as for listening well and respectfully during disagreement, since both are important for healthy dialogue.
And you and I were with the Timcast talking about how not speaking up has allowed psychological training to be captured by concerns that are really not related to psychological training.
So true. I mean, groupthink is actually facilitated by people being quiet. It's literally part of the, textbook recipe for groupthink is when people are doing self-censorship, then there creates this illusion of unanimity where, you think you're the only one who thinks the emperor has no clothes. But the more people that are silent, then the crazier, people start getting. So we have to speak up. So I'm glad we're here to do that today.
Yes, it's usually 10 or 20% that speak up. Be a part of it. So let's talk about this young individual that shot up a church. Did you see the video that that person put up? I don't know what this person should be called. I don't know what to he or she. Because in the manifesto, this person is saying that they regret changing gender, and it sounded like they were wanting to switch back. So I don't know what the actual volition would be. Nor do I don't think we should be paying a lot of attention to that, given this person perpetrated such a horrible crime. But I'm wondering if you saw the little video before this all went down.
Yeah, I saw parts of it, but like you, I've really been focused on the outcome of it. A lot of people are saying, that it's wrong or irrelevant to reference the fact that this person was trans. I mean, again, everybody has their own way, I think, of identifying it. But for me, my interest in free speech also just has to do with speaking accurately and precisely. So just my way of describing this person is a trans-identified male, meaning it's a man that identified as trans and, wanted to be perceived as a woman. Although later in life, as you mentioned, even in writings, indicated that perhaps was changing his mind about that as well. So as far as his preferences on what to be called is one thing, as far as what he actually, was another. And when people say that it's irrelevant to even bring that up, I think that's incorrect because first of all, he shot up a Catholic school. And it's a fair point to say, the Catholic Church has ideological differences with trans ideology. And so there would naturally be a friction. I believe that he also actually had, pictures of Jesus with a crosshairs on his face. So to say that there was no, possible component of this person's sexuality that was relevant here, I think is really missing something that even this person himself, wanted us to see. And moreover, when we stop people from speaking openly and clearly and precisely, we stop people from forming social consensus and we actually interrupt their own thought process. So I'm a big one for just saying it like it is.
The statements in the manifesto were that this person was feeling that he was sad that he'd been brainwashed. He wished he hadn't let himself to be brainwashed, which is a very specific and rather powerful suggestion. It wasn't just, hey, I'm musing, but maybe I made the wrong choice. It's like, no, I was brainwashed. That's sort of an extraordinary statement, number one. Number two, I think it's important to talk about the trans identification because there were physicians treating this person. And my question to those physicians would be, is this person better now? Did you make them better as a result of your treatment? Is this a good outcome? And if it's not a good outcome, what went wrong exactly? Exactly what happened here. You need to do a post-mortem, a morbidity mortality weekly report sort of assessment of what went down with this case and why it turned out so badly. And the fact, what I saw in that video was evidence of full-blown psychopathy. I didn't see psychosis so much, though that could have been embedded in all that. I saw psychopathy. Why did you miss that? Why did you miss that? And why did you treat this person? Why did you leave out the context for the condition you were treating for this individual? Or did you? Did you do some things? We don't know for sure. But this all needs to be answered because my profession, this is not yours, Chloe, mine is missing their fundamental charge, which is to select the right treatment for the right patient. That increases the probability of a good outcome. A correct patient, exactly what patient profile, exactly is going to benefit from exactly what treatment. And we don't seem to be, seems to be we're doing none of that.
No, I would totally agree with you. And you raised an interesting point there about psychosis and psychopathy. So, for your audience, in case they're not sure what that means, psychosis is when we have a break with reality. Psychopathy is when, we essentially numb out to the feelings of others, essentially. So, it kind of like sociopathic, psychopathic, there's a lot of overlap there. What I would actually say, since you also brought up the interesting point about brainwashing, is that it almost, in my view, as a clinical psychologist, is a form of psychosis for a man to believe he is a woman because he grows his hair long and, takes some hormones or whatever. And so I think this person may have, in a sense, been even coming out of a psychosis and, recognizing, hey, I'm just a man with long hair. And in fact, he even said in his manifesto, I feel like I would just shave off or cut my hair. I'm so done with this, but that would be like admitting, that I was wrong about all of this. So to your point as well, Dr. Drew, it's shocking, yet not shocking to me that his, quote, medical team didn't even have like some kind of a protocol in place with him, as I believe they should with all people that go down this medical road, which frankly, I have questions about in the first place, but to at least give them an off-ramp to say, hey, if you ever start to think this isn't for you, here's the normalized way to like get out of it. It seems, and I don't know obviously, but it seems like that wasn't something that he was aware of.
Oh, I'm sure that there's nothing like that being offered. But I'm going to push back a little bit on what you're saying about it being a psychotic. Is if you must not have yet encountered people that were the right patients who got the right treatment, because I know a number of them, and they are. It feels completely aligned. It feels like, oh, this is a condition properly assessed, properly treated. Needs no further discussion.
I don't think that is psychotics. Just to make it super clear, because thank you, that's an important clarification. If you have a man, like, for example, Jenner, Bruce/Caitlyn Jenner, is fully aware that he is a man who has had a lot of cosmetic adjustments to make himself appear as if he's a woman, and mentally he likes to think of himself that way. But even he has made it clear he would never, try to take on a woman in sports. He knows that's not fair. Again, psychoticism is a break with reality. He knows exactly who he is and what he's doing. I think especially with teenagers, because their perception of reality and their perception of their own identification even is, more fluid, they're trying things on. A lot of them are actually told that this will change their sex. They're actually told that, which I think is psychotic.
And to drill, to maybe pile on to what you were saying about Caitlyn, because I've talked to her about this, is what you will hear from people who are properly selected and properly treated is, I have a condition and I have to take dangerous medication the rest of my life, and it's working for me. I would rather not. And Caitlyn said something specific to me. He said, but when you're dealing with me, don't even think about it. I'm also left-handed, so just put it in the same category as that, because it's something I just have to live with. And I thought, oh, fine, no problem. And I know a number of people like that were carefully selected, carefully treated, and live. I mean, It's not an issue. It's like not even an object of discussion in their life any more than I take high blood pressure medicine. It's the same kind of thing. But anyway, I want to go back to this kid. The cold-bloodedness of all of it was what jumped out at me. And my patients don't really have cold-blooded kinds of impulses. When they get psychotic or they get manic or they get addicted, they may do bad things, but they're not that cold-bloodedness. My hair stands up in the back of my neck still when I think about that video. And yet this person didn't continue shooting. They just shoot a couple of times. I thought it was going to be, based on that video, I thought he had potential to do just tremendous damage. What do you think happened there when he just stopped and shot himself? I guess we were led to believe that's what happened.
Yeah, I mean, I don't know. Obviously, I think anyone who claims to know, is a little maybe psychotic themselves, I guess, as far as being outside of reality. I mean, I certainly don't know. However, I do think it's really important that we study exactly what medications he was on. And I don't even just mean whatever medications were part of this, trans plan, but, maybe there's even something as simple as SSRIs, and maybe there's drug interactions. Yeah. Also, this person obviously did not even feel comfortable discussing with his own medical team that he was not feeling on board with his own plan. So that tells me that he was in a great deal of isolation. It suggests, maybe he was obviously having trouble communicating. And again, it's part of my whole interest in free speech is we know that when people are prone to violence, the first thing we want to do is help them learn to use their words. We want to teach them to speak their mind, no matter what it might be, so that they don't act out in violence. I can't help but wonder on some level if this was, as you said, a really psychopathic form of acting out. I believe that this person's mother at one point was a teacher at that school. I mean, I have no idea, but it could be that he wanted to have been one of those little Catholic school children that just fit in and they had this beautiful life, but he couldn't have it, and he was acting out, very violently by just erasing them and then erasing himself. But I certainly don't know, obviously. All we can do is speculate, but I would really like to understand what was going on with his medical panel as well as with his doctor communications, like you mentioned.
Right. And then that be published so people can, not that he is, I guess it would be reasonable to publish it. And so people can learn from this and adjust their treatment plans. Oh, I get sick when I think about this. It was a chilling thing. And as you were talking, I started thinking to myself, God, we have a problem with violence in this country. And it's not even guns, it's just violence. Is that something you're thinking at all about? And you mentioned psychopathic acting out. So much of the violence is in that kind of zone where it's either impulsive, blackout, red out, white out kind of acting out, or actually some sort of annihilation impulse. Yeah. What are your thoughts?
Yeah, definitely. So, I mean, I think that there's a lot of this words are violence talk, or frankly, especially within the trans identity, you have people that say, if you don't respect my pronouns, you're, quote, threatening my existence. And so when we start saying things like words are violence, you are threatening my existence, as I talk about in my book, can I say that? Why free speech matters and how to use it fearlessly. Part of what I'm saying is that if we don't understand that words are actually not violence, and no, speaking up and calling that person trans is not hateful. What he did was hateful, but naming it and discussing it accurately is not hateful. Again, in fact, we need more speech, not less, if we want to avoid violence. I believe a fair amount of the violence that we're having is because people are not communicating, number one, which just tends to facilitate people acting out violently, but combined with the fact that we're telling people that words are violence or silence is violence, or if you don't validate me, then you're threatening my existence. I think on some level, people are acting out violently as what they think is a form of self-defense against words or opinions that they don't like.
That's interesting. I want to pile on your book a little bit, because the book is not just a little how to speak up. It's encyclopedic. It gets into very specific situations and lots of very specific advice for lots of circumstances in which free speech matters.
Thank you. Yeah, thank you so much. And I actually explored the trans issue, quite a lot there. And, I want to say as well, based on what I said earlier, if somebody wants to put on a dress, if a man wants to dress like a woman or a woman wants to dress like a man, I don't consider that to be psychotic. What I consider to be psychotic is when someone starts like literally believing that that's what they are, or if when you want to talk about it with them, that they want to say that you're threatening their existence, or, who was that Congresswoman, Penny or Peggy, somebody that was wearing the T-shirt that said, protect trans kids at all costs. And it literally had like a bloody knife on it. And this was one of our, lawmakers. So I think words are getting weaponized, but not in the direction that people think. It's actually, I think, more hateful to try to silence speech than it is, whatever is often being called as hate speech is in many cases, just opinions people don't like. And then, what an anxiety-provoking way to live your life, too, right? To think that if you say the wrong thing, it's like hitting someone with your car, or if God forbid, you hear the wrong thing, it's like someone threatened your existence. Dr. Drew, you and I both know that if a client comes to us and says, I'm thinking of going to physically hurt my neighbor, we have a duty to warn. But if our patient comes to us in confidentiality and says, I'm going to go tell my neighbor something really nasty, then we would be literally breaking the law if we violated that confidence. And so people really need to understand words are not violence. And I think that's actually, ironically, what's leading to some of the violence we see today.
I wonder why there's so much violent rhetoric around this one topic. It's kind of interesting. I really, there's got to be a history there where somebody really massaged that, because it's not a topic that naturally would have to be discussed with violent rhetoric. It just isn't.
Two things. Well, first of all, it's the only group where they say you're threatening my existence. If you don't say or perceive me the way I want you to, you are threatening my existence. Again, we're getting into self-defense territory there. If we take that literally, that basically means you're threatening to kill me. So to answer your question, why do we see so much violence there? These are people who, to use this person's word, brainwashed, may have even been brainwashed to believe that they have to, quote, defend their life at all costs if somebody's not pronouncing them the right way. And then moreover, a lot of them are on a lot of drugs, a lot of, somewhat experimental. I would question the health even of some of these drug protocols. Plus, many of them are on other psychiatric medications as well. And we may not fully understand the way that all of those drugs are cocktailing inside of them.
Yeah, the medication, again, this is part of, there's a bigger topic here in this country where medications are supposed to make life great, life better. Medications are designed, they're risky propositions, often dangerous propositions, to address disabling and fatal illness. That's it. And if you have a severe condition where you could harm yourself if we don't treat you with certain medications, okay, it's worth the risk. But they are not making you healthier. That's not the case. It may be creating an alignment that you can be safe with, that is carefully managed, and the risk rewards are constantly assessed and carefully followed up, and asking lots of questions is the point. The doctor needs to be there and follow and check and double check and make sure their treatments are working and not harming the patient. It's not just simply making life better. Medicines are dangerous. All medicine. There's some data that came out today that associated acetaminophen, Tylenol during pregnancy with autism. That makes perfect sense to me. Medicines are dangerous. We take them when the risk is worth it. Well, Chloe, listen, it's always fun to talk to you. What else is on your radar these days?
Well, I'm super excited. I've been doing a lot of speaking around the new book. So if people are interested in, book clubs or anything like that, I'm super excited to just connect with people. Just the more that I talk about free speech and the more that I speak freely, I almost feel like I've come out of the closet or something. And so my whole point about the mental health benefits of free speech is that I believe your brain functions better, your cognitions are clearer, you're more emotionally present. So I've been on a real kick with that, just talking and connecting with people about it. And it's definitely been good for me. So thanks again for giving me the chance to talk about it.
Yeah, it is important. We look at what's going on in Europe right now. It's just hard to believe that it's really the fact that we have these prescriptions in the law give us the opportunity to go forward and defend free speech and to, talk about things that may be uncomfortable, but we have to be able to do it. Though I think the next interesting topic around free speech will be hate speech, whether it's a real thing or not. I haven't formulated my opinion yet, but I'm hearing people say there should be no hate speech. It's just speech. Speech is speech, and we may not like it. We may feel like it's hateful. Do you have an opinion on that?
Yeah, I do. So I think absolutely we can say hateful things. And in fact, there are things I hate. And I should be able to talk about it, If anybody can say that there's truly nothing that they hate, I mean, I could start naming. Do we hate that this man just went and shot and killed a bunch of Catholic school children while they were praying? I hate that. But interestingly, though, even if we want to get into like the type of hate speech that we would all agree is bad, okay, so one of the things I talk about in my book actually is people that have left the KKK, people that have left being, wrapped up in the Taliban, people that have actually left truly bad, hateful groups. You know why they leave? It's so interesting. Most of them will say that they left because somebody talked to them, somebody listened to them, somebody let them say all the things. In fact, there's a man, I wish I could remember his name. His name is Daryl something. I can't remember his last name, but I talk about him in the book. He's a black jazz artist, and he has a collection of over a dozen KKK hoods that have been handed to him. He made a life's work of sitting as a black man with multiple members of the KKK, listening to them, and through those conversations, changing them. Now, it is not his responsibility to change them. Just like as a woman, it's not my job to go out there and change people who are misogynist. I'm not saying that. But at the same time, we have to understand that there is a healing power in dialogue, and people can say things that are hateful. We can even perhaps certainly hate things, and we should hate them. But the last thing we want to do is tell people not to talk about it, because all that does is make it fester and cause them to act out.
Chloe, thank you so much. Dr. Chloe Carmichael, Dr. Chloe, Dr. Chloe on X, and drchloe.com. And can I say that?
Thank you so much, Dr. Drew. Great to be with you. And freespeechtoday.com is another super easy way to find the book.
Excellent. Thanks so much, Chloe.
Thanks.